Welcome to Study Nurse IQ. I'm Jenny. Today we'll explore the essential principles of medical history taking, a crucial skill for every nursing student. Let's dive into the fundamentals of history taking, a skill that can make or break your patient assessments. Imagine missing a crucial detail in your patient's history that could have prevented a serious complication. That's why mastering history taking is essential for patient safety and care quality. By the end of this video, you'll understand the key components of history taking, master essential questioning techniques, and learn common pitfalls to avoid. Medical history taking is a systematic process of gathering patient information. It's your first and most powerful diagnostic tool. NCLEX tip: remember, history taking questions often test your critical thinking skills. Focus on identifying red flags and prioritizing patient concerns. The key components of a medical history include chief complaint, the patient's main reason for seeking care; history of present illness, detailed description of current symptoms; past medical history, previous conditions and treatments; medications, both prescription and over-the-counter; allergies to medications and other substances; family history, focusing on hereditary conditions; social history, lifestyle and environmental factors; review of systems, comprehensive head-to-toe assessment; and functional assessment, especially important for older adults to evaluate their activities of daily living, ADLs. When documenting the chief complaint, use the patient's own words. Focus on their primary concern and what brought them in today. Must know: always watch for red flag symptoms that require immediate attention, such as chest pain radiating to arm or jaw, sudden severe headache described as worst of life, syncope or loss of consciousness, hematemesis or melena, blood in vomit or stool, new confusion or difficulty speaking, and any expression of suicidal ideation. These symptoms warrant urgent evaluation. When documenting present illness, remember OLDCARTS: onset, location, duration, characteristics, aggravating factors, relieving factors, timing, and severity. Past medical history should include all previous diagnoses, surgeries, hospitalizations, and significant health events. For medication history, document current medications, dosages, frequencies, and any recent changes. Don't forget to ask about over-the-counter medications and supplements. Family history helps identify genetic risk factors. Focus on first-degree relatives and major hereditary conditions. Social history includes lifestyle factors like smoking, alcohol use, occupation, living situation, and support systems. NCLEX tip: focus on prioritization and relevance when documenting patient history. What's most important for the current situation? Review of systems should be systematic and thorough, covering all major body systems from head to toe. Effective communication is key. Use open-ended questions, active listening, and appropriate nonverbal cues. Always consider cultural factors that may influence health beliefs, practices, and communication styles. Must know: avoid common pitfalls like leading questions, interrupting patients, or making assumptions. Adapt your approach for different populations like pediatric, elderly, or non-English speaking patients. Remember to document clearly, accurately, and objectively. Use proper medical terminology and standardized formats. Let's practice with an NCLEX-style question. A patient presents with chest pain. Which history component should the nurse assess first? The correct answer is C, present illness details. In acute presentations, always prioritize current symptoms and their characteristics using the OLDCARTS framework. Next question. Which of the following is not a component of the OLDCARTS assessment framework? The correct answer is C, treatment. While treatment is important, it's not part of the OLDCARTS framework used for assessing present illness. Final question. A patient gives vague answers about medication history. What should the nurse do first? The correct answer is B, ask specific questions. Always clarify vague responses with focused, specific questions before making assumptions or moving on. Now let's work through a case together to practice our history-taking skills. Here's our patient scenario. A patient comes in, reporting abdominal pain for 3 days. The pain is sharp, located in the right lower quadrant, worsens with movement, and is associated with nausea. No fever is present, and the patient denies any trauma or similar pain in the past. Let's analyze this systematically using our OLDCARTS framework. First, let's identify our chief complaint. In the patient's own words, it's abdominal pain. Now let's break down each element. For onset, we can clearly identify when this started, 3 days ago. This is important because acute onset can suggest different conditions than chronic pain. Looking at location, the pain is specifically in the right lower quadrant. This is a crucial detail that can help narrow down our differential diagnosis. For duration, we know this has been a constant issue for 3 days, showing this isn't a transient problem. The characteristics are well defined. The patient describes a sharp pain, which gives us insight into the nature of the discomfort. For aggravating factors, we've identified that movement makes the pain worse. This is a significant clinical finding. Regarding relieving factors, interestingly, none were reported by the patient. Sometimes what doesn't help can be as informative as what does. The timing appears to be constant since onset, which is another important clinical detail. Finally, while severity wasn't explicitly specified in this case, this would be something we'd want to assess using a pain scale. Review our top 3 takeaways. Use systematic approach, document accurately, and always verify unclear information. Thanks for watching. Don't forget to subscribe to Study Nurse IQ on YouTube for more nursing school, ATI, and NCLEX preparation content. See you in the next video.